trained to think about prevention, not just treatment. The Planetary Health Alliance 2025 describes us as potential communicators, educators, advocates, and leaders for a climate-resilient future.
The question isn't whether heat waves will continue. They will. Temperatures are rising, and even with aggressive carbon reduction, we're committed to negative performance. The question is, will we adapt? Will we build resilience? Will we center equity and protect the most vulnerable?
As future nurses, we all have the responsibilities and opportunities to say yes. We can educate patients, adapt to our practice, advocate for policy change, and research more healthier.
In the course, because unfortunately in the UK, I don't know if we have colleagues from the UK, generally we don't teach that, but because my background is Africa, we were taught all this microbiology, pharmacology, medical, surgical, medical surgical, I forgot what you call it. So we taught medicine, surgery, and everything in our course. But on getting here, you see that is not applicable. So, and the question I always ask when we have curriculum reviews and things is that, all right, I'm teaching a student how to nurse a patient, especially I'm a mental health, sorry, I forgot to say that, I'm a mental health specialist. So I'm teaching a student how to look after a patient that has schizophrenia, but I never taught them what schizophrenia is. So what do I expect? And how do I expect them to be efficient enough? But because we are nurses, we teach nursing care, people believe, oh yeah, it's nursing care. Then if you start teaching all these disease conditions and things like that, pharmacology, although we do a bit of pharmacology, but not directly as a module. So it's like an adjunct because they need to learn and pass drug calculation. So, but microbiology, not at all. So, to me, the question now is that, all right, we want students, when they qualify, to be able to apply the knowledge into practice. How do we expect them to be able to apply the knowledge? Where is the knowledge from? We recently had a curriculum review, and the students themselves are asking that question. And I've been asking this question for 5 years in my new university. But they told me it's a medical model. I said, yes, it's a medical model, but as nurses, we are in the center of the care. We are liaised with the medical team, surgical team, physiotherapy, psychology, every other thing. So how do we become a very, very efficient professional nurse if we omit all these areas? So I really appreciate that that is still ongoing. Please, let's keep it in the program. Don't let them remove it from the program. Yeah. Then
we have the scientists teaching microbiology,
yeah.
The pharmacists teaching pharmacology, and what we, I guess, fundamentally we believe, if you don't have knowledge, you can't plan and anticipate care, I guess. And that as nurses, we hold the responsibility for patient education. We're there 24/7, you know, and what we can do, we can't teach everything, can we? But we can foster curiosity. And so it seems that that students get an umbrella sort of understanding of what's happening. And then when they go to clinical placement, we expect that they are able to say, I'm caring for Mr. Brown, he's 68, he has CORD. We expect that they tell us the pathophysiology of CORD and the treatment, you know, the medications and the proposed treatment. Now, what I haven't got up there is that our nursing council now says, actually, you've got enough knowledge in nursing to develop differential diagnoses to support the formation of the medical differential diagnoses. So I mean, things are changing. So our students must have that knowledge to support.
I agree with you. I can't agree less. And another point, you know, in the UK we talk about interprofessional learning. Unfortunately, there is no interprofessional learning. Our interprofessional learning is only in practice. I don't know if anyone is in the UK. Yes, it's only in practice. We don't have any module where we bring in different professionals to sit in the same class to receive the same knowledge. None. I've been in like about 2-3 universities, and it's all the same. Anyone can prove me wrong. But when we're talking about interprofessional nursing or interprofessional learning, and you see that in the developing country and even in the developed countries as well, you see that there is still a little bit of this friction between nurses, doctors, physiotherapists, and so on and so forth. Because you don't bring them together. You don't make them to believe that they are equal. Because if you make them to believe that they are equal, the only way you can do it is not by telling them, is bring them into a model like you just showed, interconnectedness. We call it interprofessional nursing in the UK, or learning. You just need to bring them together. Let them learn the same thing. When they get into practice, they will respect each other. They will know that you are not better than me, I'm not better than you. We sat in the same class. Unfortunately, it's only in practice we tend